In this session, I am going to comment the Spanish experience with COVID, and we are going to present some very preliminary data about two studies that we are developing in our country. And the first is about severity and clinical outcome of mortality in multiple myeloma, the perspective of 1 year of pandemic. And we have, for this project, we have analyzed 387 patients. We have separated in two periods. This patient, the first period is the first 3 months of the pandemic, and we have included 189 patients. And the second period is the rest of the time, because in this we have learned how manage this patient, and the health system is not overexpressed. And we have obtained very surprising results, because although the severity has been reduced because we are diagnosing more patients, the severity in the second period is lower, 51%. In the first period was lower. Was higher, 75%. However, the mortality in the patients that have been hospitalized in both periods are very similar and very high. 32% in the first period and 35% in the second period of time. And also, we have found that over the time the treatment have been changed. We are using the second period more remdesivir and corticoid than in the first period of time. But even though the mortality have not changed. This is the result of the first study, and the second study is about the impact in patients with multiple myeloma based on a real-world data network called Trinetics platform. Trinetics is a global federated health research network that has access to electronic medical records from organizations all over the world. And we are participating. Our hospital is very implicated in this real data network platform. And we have analyzed between 2019 and 2021, we have analyzed three networks: the network of our hospital, the network of EMEA in Europe, that include 6 million of patients, and the global network that includes 66 million of patients. Regarding myeloma, we have analyzed data from 55 myeloma patients in our hospital, and more than 600,000 patients in the EMEA network. Globally, we have analyzed more than 80,000 patients globally. We hypothesize that the COVID-19 pandemic might have decreased or delayed the diagnosis of multiple myeloma patients. And also we want to confirm that myeloma patients were more impacted by COVID-19 than non-myeloma patients in terms of incidence of infection and survival outcomes. First of all, we have found that the number of new multiple myeloma diagnosis was lower in 2010 than in 2019 in the three network. Also, the likelihood of being diagnosed with COVID-19 was higher in multiple myeloma patients than in patients without multiple myeloma in the three networks, with a ratio of 1.2 to 2.1. That means that the probability to get COVID-19 in multiple myeloma patient is around 20% higher than in in patients without myeloma and cancer. Finally, we analyzed the impact on survival of multiple myeloma in patients diagnosed in 2019 and 2020, and we show the probabilities of survival after the diagnosis was lower in patients diagnosed in 2020. In two networks in our hospital in the EMEA network. So, as conclusion, COVID-19 has a right to stay with us for a long time, even with vaccination, and we should learn to live together with COVID-19 and protect our myeloma patients from it.